Hi everybody, it's Kathy, dietitian with Highland Primary Care in Airdrie, and using this opportunity with the bad weather and some cancellations to do a couple of diabetes videos for you. So the first one will be the basics of diabetes, and the part 2 will be healthy eating with diabetes. I'm going to really try to listen to the feedback and keep it short. So we're going to dive straight in here. So what we're going to talk about today is just what is diabetes, and basically it's a mismatch between the carbohydrate or foods that turn to sugar and the insulin that your body produces. And then we'll talk a little bit about some of the factors that we can't control, some of the risk factors, but what we'll spend more of the time on is just things we can control. So some habits that we can work on or look at. And I just like to tell people that sometimes we are doing all the right things, but it's just the way our genes are that has sort of loaded us for this happening. So because sometimes people get really discouraged when they're doing healthy behaviors. And I just want to say that it's nothing you did wrong. It's just that that's just the way our genes are sometimes. So some habits under our control. So stress reduction, meaningful home blood glucose monitoring, and active living is what we'll talk about today in this video. And then the part 2 will be that healthy eating basics. And yeah, it's the most requested video from our nurses, so I really hope it's helpful for you. In all my classes, I just like people to take a second. We know that the science tells us that if people engage in a healthy set of behaviors, so healthy eating, active living, moderate or absence of alcohol, and absence of tobacco, just those 4 healthy behaviors. Of course, there are other ones like sleep and stress reduction, but they're just looking at those 4. And if those 4 are in place, on average, when we look at a big population of people, we live a quantity and quality of life 7 years longer. So I just like to give people a chance to think about all the things they love to do and the people that they love, of course, and the things we want to be around to see and do, because that's usually a pretty good indication of our with them or what's in it for me. It's nice to write those down too, or keep pictures or something that reminds us, because health change is very hard. And even little changes are very hard when we're sort of set in our ways. So if you've made some health changes already, congratulate yourself. If you're even thinking about that, that's a really good place to be too. What is type 2 diabetes? So this class, you could have been diagnosed with diabetes for a really long time, or maybe it's a new diagnosis for you, or maybe you're just hoping to keep diabetes at bay, like you have some risk factors or some family history. And no matter what brings you here, I'm so happy that you're here, because any information that can help us make some health change is a really positive thing to do. It's a little bit like an investment over time that will pay off. Yeah, so type 2 diabetes, in the most simple way to explain it in a nutshell, is that it's a disease in which your body can't produce enough insulin, or we just can't properly use the insulin that we produce. So it begs the question, right? Red is insulin. So insulin is a hormone that's produced by your pancreas. It basically, I like to think of it as like a key. So it's a key that opens our cell doors and lets the sugar from the blood into our cells. And I'll just show you this little guy. So this is an example of an artery with healthy blood flow. So the blood sugar is low here. And I lost the one, unfortunately, of the high blood sugar, but basically it would look like honey in here. It would just flow really thick and slow. So what we want to do is get it out of the blood and into the cells where we need to use it for our muscles. If all you remember about insulin is it reduces the amount of sugar in your blood, then that's fine by me. But insulin resistance can happen. So I like to think of this as like sticky door, or there's the key, we talked about insulin, the key, and the cell door can be like a lock, or it can be sticky, and the insulin's there and the cell's there, but the insulin can't do what it needs to do. So that cell the sugar's just not getting into the cell where it needs to be. That door is sticky, or the lock just isn't working for some reason. That's what we call in medical terms insulin resistance. The other thing that can happen, just for my memory, I like to make things easier to remember. So pooped out pancreas is what I say. Basically, there's just not enough insulin to deal with the amount of foods, carbohydrate or foods that turn to sugar that we bring in. and it sometimes just burns out a little bit. There are things we can do to help, and just as a little sneak peek into the next video, regular meals at regular times does help the pancreas if we can be as consistent as we can with our intake, and especially the amount of carbohydrates. This will make more sense in the next video, but that the pancreas will, whatever it is producing, it will help us to use it better. The body really does like patterns in that way. So yeah, some signs and symptoms of diabetes. This is really good to know about. Know that these symptoms aren't exclusive to diabetes. There could definitely be something else going on. But if these symptoms are about, that it's definitely a good time to see our doctor and get our blood sugars checked. So yeah, things like excessive thirst and urination is often what will bring people in. A really common thing that happens is somebody will feel quite thirsty and they'll grab a juice or a pop, and they just seem to be getting thirstier and thirstier, and the blood sugars are going sky high. I've definitely seen a few people end up in urgent care because of that happening. But other things that might happen, just unintentional weight changes, excessive hunger, a fatigue or lack of energy, blurred vision, frequent infections, tingling in your hands or your feet. That one just pops right out, doesn't it, guys? Erectile difficulties, slow healing cuts or sores, and itchy skin, typically in the groin area. So again, not exclusive to diabetes, but just a good time to have a conversation with the nurse or doctor in your medical home and have some screening done. Yeah, screening, recommend everyone over 40 has an A1C done at least every 3 years. But if there's any risk factors, which we'll just talk about in 1 second, more frequent screening is recommended. Oh, the A1C. So yeah, what is an A1C? It's basically a 3-month average of what your blood sugars are doing. So there are a few different types of tests for blood sugars. So they might do a random blood sugar. If you're going into the lab and you haven't been fasting, then they might just do, that just shows you what your blood sugar is right at that moment. If you've been fasting, they might do a fasting blood sugar. So our blood sugar before we have anything to eat. But quite often they will do this A1C because it really tells us what's gone on for the last little while, like the last 3 months. If you've been diagnosed with diabetes, we usually want to try to get that into targets right away. The research would tell us like the outcomes with diabetes are much better the more aggressive we get with it sooner. So that's sometimes why the doctors will want to put you on medication right away to get the A1C down. That in some cases makes a lot of sense. And I know sometimes people are resistant and they want to try diet and lifestyle, which totally I'm on board for. But sometimes when the blood sugars are quite high, we might need some medication to help us get it down, at least for a time. Like it's not unheard of to need it while you get your habit changes, and then maybe need less, or maybe you can control it with diet and lifestyle. So cool thing about small reductions in A1C, you'll cut your risk of eye, kidney, and nerve disease by about 25%. So that's actually quite huge. You're 19% less likely to suffer cataracts, 16% less likely for heart failure, 43% less likely for amputation, and even worse outcomes like death. So that's really huge. Just a 1% gives you a 43% less risk of amputation. So it's huge. A1C, if you're not in control, should be tested every 3 months. And then once you get control, they still recommend twice a year. Excuse me. So I did say we'd talk about the risk factors. Age over 40. So once we get over 40, it's an automatic risk factor. A first degree relative with diabetes type 2. If you're a part of a high-risk population, certain ethnic populations have a higher risk of diabetes. If you've had diabetes in your pregnancy or gestational diabetes, any sort of other blood vessel risk like high cholesterol, presence of any organ damage like retinopathy, so that's your eyes, or neuropathy. Any associated conditions or presence of drugs associated with diabetes. So probably the most common one I can think of is like a corticosteroid. If you take that on a regular basis, that does put you at higher risk for diabetes. So why treat diabetes? That's the burning question. And I like to really tell people that having diabetes isn't scary, but having it and not treating it or trying to ignore it can have some complications, which can be scary. And I do think that initial diagnosis can kind of catch you off guard sometimes. So that's really normal. But we do want to try what I know many patients who have lived a really long time with diabetes and still live very happy and healthy lives. So, but they do take steps to manage it, and that's all. So things that can happen are kidney disease, foot and leg problems, that eye disease or retinopathy, heart attack and stroke, anxiety, nerve damage, erectile dysfunction, all of those, if we don't pay attention to diabetes when we're diagnosed with it. So this one's really important just to go over. Hypoglycemia just means low blood sugar. It's rare if you're not on any medications. It would be very rare to get low blood sugar or hypoglycemia. It's typically the medications that bring it down below our normal ranges, but it is still good to know the signs and symptoms. Sometimes I just like to let people know that sometimes our blood sugars have been high for a really long time. And when they start to come back into normal ranges, because we're doing healthy behaviors, we can sometimes have some of these signs and symptoms and our blood sugars can be normal. But it's a good time to check them if you have a monitor for sure. And if you don't and you have these symptoms, you need to check them. It might be a good sign to get a monitor if you haven't got one already. So some of the symptoms: shaky, fast heartbeat, feeling sweaty, dizzy, numbness in your mouth, hungry, blurred vision, weak or tired, headache or confused, nervous, anxious, or upset, any of these. And we should treat them. So standard treatment, if you are measuring under 4, is to have 15 grams of fast-acting carbohydrate or sugar. So 3 or 4 dextrose tablets, or 3 packets of dissolved table sugar, half a cup of apple juice, 1 tablespoon of honey, or half a cup of regular soda. So after you treat it, you would wait 15 minutes and test your blood sugars again. And if it's still less than 4, you need to treat the same way we talked about. So that fast-acting sugar. If it's greater than 4, then if you're going to eat, if you're eating a meal within 45 minutes, then you're okay. But if it's going to be longer than that, then you need a snack right away, preferably with something with carbohydrate and protein, like cheese and crackers, or apple and peanut butter, or some nuts and fruit, anything like that. And if you have any questions about this, this is real important. This is not a bad one to connect with the nurse in your medical home or come to class, because I'll always answer your questions in person in class. Yeah, so what can we do to live healthy with diabetes? These are the factors we can control. So that meaningful home blood glucose monitoring, I keep tripping over it, sorry, stress reduction, and then active living. And healthy eating will defer to the next video, but I'll do those top 3 in this one. So home blood glucose monitoring. Just perhaps you have the targets already, but in case you don't, so fasting blood sugar should be between 4 and 7. And then our blood sugars 2 hours after eating, we like it between 5 and 10. And if people are having trouble getting to targets into the A1C, we might even ask you to get a more narrow target. So between 5 and 8 post meals, 2 hours post meals. We say 2 hours after meals because it is very normal for your blood sugars to go up after you eat, but we do want them to be coming back down into range by that 2-hour mark. So fasting between 4 and 7, and 2 hours after between 5 and 10, typically. So I really love when people will test their sugars, even if they're, they're just borderline or whatever the doctor might call it, if they haven't quite been diagnosed with diabetes yet. It just helps us to give more information without any monitoring. We can only give you population recommendations. So the recommendations we give to everybody else. When we know what's going on with your blood sugars, we can tailor our recommendations to you. So maybe you can handle a little more carbohydrate in the morning. And maybe there's a meal that we do need to tweak because that's the one where the sugars are running a bit high. So we just want to see how your body uses the insulin that it is producing. So we recommend testing that helps us figure that out. My personal favorite as a dietitian is if somebody does like a before meal and 2 hours after. To me, that gives me a lot of information about what's going on there. I do like people to do fasting sugars once in a while so we can see if there's any patterns there. I find my patients really like it when they do before and after a walk because they can see like, wow, a little walk really does make a difference. And the research would say it's actually as powerful as some of the medications for diabetes. So, but it's nice to see it, see that data. Yeah. So you don't have to test 4 times a day, a few times a week, depending on, of course, if you've had recommendations specific to you from a health professional, please follow that. But if you're sort of on the fence or weren't doing it at all, 3 times a week is giving us some information that we didn't have before. So don't think just because you buy a monitor, and usually the monitors are free, but we do have to pay for the strips. Some of us have coverage for them. If they're not covered, they are quite pricey for sure. I admit that. So you don't want to maybe use a lot of strips. You don't have to test all the time, but maybe if one day you test your fasting, maybe the next day you test 2 hours after breakfast, you could do before and after breakfast or just after. Maybe you skip a day and then on Wednesday you do after lunch, that kind of thing. You don't have to test all the time. And after a few weeks, we'd see some patterns that would help us likely. So that's all on home blood glucose monitoring. Like I said, I'm trying to keep it short. This is not all the information you need. It's just giving you some background of things we say all the time. If you do have any questions, if you want to get a monitor, make an appointment at your local pharmacy. If you have a pharmacist that you really trust, they will set you up with a monitor that'll really work for you. If you're techie, one that will work with an app on your phone. There's all kinds of cool monitors now, and the lances are so amazing from even a few years ago. The little poke they make, you almost can't feel it at all. It's so small. So yeah, set an appointment with your pharmacist. Usually the monitor is free as long as you're paying for the strips. Our power just came back on. That's what the lights happen there. Yeah, and I'm gonna go on to stress reduction. So yeah, I won't go into this too much. We do have a couple of videos on our YouTube channel about stress, but just like to let people know that it is a factor. So if the stress level has been really high, what can happen in diabetes is that when the stress level is high, we basically use a primitive part of the brain. It's the first part of the brain that came online, and its reaction to stress, whether that stress is I didn't sleep good or I didn't eat good, or a psychological kind of stress, like I had a fight with somebody, it still goes all in one bucket, and it uses that primitive part of the brain. And that primitive part of the brain wants to fight or flight. So it wants to get nutrition to the big muscles. So typically, if we think of our blood vessel here, think water in a garden hose, it tends to get squeezed. And then that puts the pressure up. The idea behind it is we're trying to get nutrition to those big muscles. So the body tends to flood itself with cholesterol and blood sugar. And ideally, those are getting pumped out to the cells where we can use it. But unfortunately, when our stresses are psychological and not so much that we need to run away from something or fight something, that extra nutrition just stays on board and causes us some issues. So that's why how diabetes can be linked with stress. So we are very good at dealing with stress. One time, like we have a car accident and then we recover, our bodies are actually really well meant to deal with that. But if the stress level is really high and staying up there all day long, this is where we can see some of these health things come into play. Yeah, so like I said, just one slide on stress. If you want to know more, though, there are a few more videos on our YouTube channel. We have Managing Anxiety and Stress class in person or virtual, and your nurse and social worker are always there in your medical home as well. So if you doctor from Airdrie out to Didsbury, you're part of the PCN, and you probably have a nurse and social worker attached that you can just make an appointment with. So our last thing that we can control in this video is the active living piece. And so the physical activity guidelines for Canadians, what we are working towards, so we don't have to do this tomorrow, is 30 minutes a day, most days, working up to 150 minutes a week, and 2 to 3 days, including 2 to 3 days of strengthening exercise. Exercise is dose responsive, so unless we're really extreme with it, and most of us aren't, that the more we do, we tend to get more benefits from it, so that's nice to know. But definitely, if you haven't been active before and you make a commitment to yourself to take a 5 or 10 minute walk after dinner on Wednesdays and Fridays, that is amazing. That's fabulous. And you probably won't create a lot of resistance. I think as humans, it's our nature to think, oh, if I don't go for like an hour, it's not worth going. But it absolutely is. A 5-minute walk is worth it. A 10-minute walk is worth it. So pace yourself, work up to the guidelines. You can break it into smaller pieces throughout the day, work at a moderate intensity. And the other thing our kinesiologist says is just thinking about a little bit how much sedentary time we actually have. So for me, I actually, in my workday, sit quite a bit. So I try to be really, really careful to not sit so much when I get home. But just thinking about how much sedentary time we actually do have, and is there any way we can reduce that? Maybe if you have a few shows that you like at night, maybe you do something on the commercials or just in between. There's one little challenge here I'll talk about in just a second that might work for that. So lots of ways to be active. That you don't have to hit the gym. It's important to find things that put a smile on your face or that you enjoy. Just thinking again to you're with them. And what might be stopping you or getting in your way. Usually it's the ruts in our brain that we fall into. And, our brain does like to keep us safe, and riding the couch looks like in the short term that it keeps us safe, although it's not great for us in the long term. So sometimes making smaller goals, like a 5 or 10 minute walk rather than something bigger, can just reduce some of that resistance in the brain. So plan ahead, think about the more the structure there is to activity, we tend to be lots better at keeping it up. So if we have a friend that we're meeting for a walk, we're less likely to talk ourselves out of it. And we're better with things like classes and things that are scheduled. But even if you don't have that, if you don't have a friend you're meeting or a class you're going to, if you say Wednesday after dinner for 10 minutes, you're much more likely to stick to it than if you just say, I'm going to walk more. So the more structure that you have about it, the more likely you are to stick with it. Yeah, and if you can fit it into your day, and one way we can do this that I'm going to talk about is this in the next slide. If you're thinking about things you can do at home, Diabetes Canada has these really awesome handouts and videos on their website. So again, you can link to this through the YouTube resources under the diabetes class, or just go to Diabetes Canada Resistance Program. This one, the third one, for some reason, is the Intro Resistance Program, which I can't figure out why they call it the third one, but it just uses bands and a chair, things you would have at home. If you don't have the bands, you can buy them at the dollar store. They're very inexpensive, and they're very accessible, quite easy activities. So those are awesome. Oh, yes, it is here. The exercise challenge, the 560 rule. I alluded to that in the slide earlier. I like it just for reducing sedentary time. So for every 60 minutes you sit, try to do 5 minutes of activity. And even if you don't make 5, maybe you make it 16-2. For every 60 minutes I sit, I'm going to get up for 2 minutes, and I'm going to walk to the printer. I'm going to take the stairs up and down. It can be really small, but if you haven't been active before, those small changes make huge differences. And when they're smaller, we're less likely to talk ourselves out of them, like I said. So that's my challenge. If you like it, then you can make it your challenge. If you found something else that you're working on, that's okay too. But this one's a really good one that lots of my patients really like. I think it's mine and the kinesiologist's favorite exercise challenge. So yeah, so we call it life enhancing movement sometimes because a few of our folks have told us they don't have great connotations about activity and exercise. And it's just things we do to live vibrantly, right? Whatever we do to keep our bodies moving. So to make you feel good, to increase your self-esteem, if you enjoy it, you're likely to continue. It'll help with stress, boredom, and tension, and improves your lean muscle mass, which in turn improves our metabolism, which as we get more trips around the sun, that is something we should really focus on for sure. And also to check the hunger cues. So sometimes we eat because we're bored, not necessarily because we're hungry. So physical activity can help with that. Oh, medication. I didn't say I was going to talk about this, but it does fit better here than with the other presentation. So like I said earlier, like the more aggressive we get with diabetes earlier, can really help with the outcomes in the long term. And I know some of my patients have been really resistant to medication, and just thought I would throw this slide in. What the medications do is they may help by decreasing the amount of sugar that we produce in the body. There's some really cool new medications. They might make the body more sensitive to insulin, so kind of addressing that insulin resistance piece, reducing the absorption of sugar so it can pass in the urine, slowing the way food is released from the stomach, or increasing insulin the body produces, or by adding insulin if you take insulin as a type 2 diabetic. And I did mention that I was going to talk about screening, and we use this ABCDs to just remind us about the things. And it's so important if you've been diagnosed with diabetes, or even if you're worried about that, that we do our regular screening, because it can really save us from some harmful outcomes in the long run. So the A stands for A1C target less than 7. Our BP target is less than 130/80. Cholesterol, we like that LDL, or the lousy cholesterol, under 2. Drugs to consider to keep your risk of cardiovascular disease or heart disease low. So things that would maybe keep your cholesterol down is maybe an example of where you might have a statin to bring our cholesterol into ranges. The E, one of my favorites, exercise, eating right. Yeah, the best form of medicine, I think, but that's my bias. So that exercise, we talked about 30 minutes a day, adding up to 150 minutes a week, being something to work towards. But if we're not active right now, that 10 minutes, fantastic, good on you. Eat right. So I'll talk about this in the next time. I really use the balance plate a lot because I find we can make changes and it doesn't have to feel too tight or restrictive. The Mediterranean diet is another one that has a ton of good research on it. Yeah, so that's another option for sure. Screening, especially important. Cardiac, feet, kidney, and eyes. Have those checked regularly to make sure everything's okay there. Smoking cessation. If you're smoking, cut down or quit. And then self-management is your own personal goals. So the ABCDs to remind us how to stay in our targets with our screenings. So yeah, resources. I can't say enough good things about Alberta Diabetes Link, and I'll just take a quick click and show you this site here. So much great stuff here, and I would go to the information sheets, and just great resources and references here to look at on a number of topics. So that's a wonderful one. And Diabetes Canada has really good resources too. And you can get the resources that are under our YouTube channel resources, take you to both Diabetes Canada and Alberta Diabetes Link. So those are there for you if you want some more information. But of course, there's always the nurse and social worker in the medical home as well. So I'll just come back to you here. There we go. So now we've got our screen up again. And it's just our last slide. A reminder that those resources are on hpcn.ca, that we do have a Facebook page, and I'll link the healthy eating video to this video, so it should come up right away for you. And I think that's all. If you do have any questions or concerns, your nurse or your social worker or your doctor in your medical home or doctor's office is probably a great place to start. If you wanted to connect with me for some questions, if you book into our in-person class, I'm always happy to answer your questions. So yeah, hope to see you soon. Check out our website for more, and the next video should be coming up soon. Okay, take care. Bye-bye.